Children who are mouth breathing, we have to ask the question, why are they breathing through an open mouth? Is it because of habit, or is it because of a nasal obstruction? Now, if the child's nose, if the front of the nose is stuffy, we can show children how to decongest the nose using simple breathing techniques. And those simple breathing techniques, they are all available for free from the Kids Corner on MyoTape.com. Now, if the child, after practicing the nose and blocking exercise, still finds it difficult to breathe through the nose, provided that the child has practiced the exercise correctly, it may point that the back of the nose is obstructed. So adenoids, which are lymphatic tissue right at the back of the nose where the nose meets the throat, can be enlarged. And if they are enlarged, it makes it difficult for the child to breathe through the nose, because the child is going to feel that they are not getting enough air, they feel air hunger, and they will automatically switch to mouth breathing, which in turn then will reinforce the nasal obstruction. So if you are teaching your child how to decongest the nose and the importance of nose breathing, and of course it's very important to talk about why is nose breathing very important for children. Development of the face, helping to ensure that the teeth are correct. It just looks natural. Sleep quality, academic performance, dental health, many factors. There are many benefits to breathing in and out through the nose. The brain of a child develops during deep sleep, slow wave sleep. But if that child is having sleep fragmentation, so for example, if they are snoring, or even if you can hear their breathing during sleep, or if they stop breathing for 2 breaths or more, that can take the child out of deep sleep, so they spend more time in light sleep, and as a result their brain doesn't get adequate development. If the brain isn't developing, this doesn't just affect that child during childhood, but these effects carry on into adulthood. So pretty much for the entire life of the child, as an adult, how they breathe during childhood is going to have some impact on their lives right the way through. Another very important point about the importance of nose breathing, of course, is craniofacial development. So with the mouth closed, the tongue should be resting in the roof of the mouth. And as the tongue is resting in the roof of the mouth, it exerts a gentle pressure and helps to direct and develop the lower half of the face. So ideally, the mouth is closed, the tongue is resting in the roof of the mouth. This exerts a gentle pressure, which helps to bring the maxilla, which is the top jaw, forward, and also helps to bring the mandible forward, which is the lower jaw. If a child has overcrowding of teeth, what does that say? Is it because the teeth are too big? Or is it because there's not enough room in the child's mouth for the teeth because the mouth is too small? What might have caused that mouth to be too small? Why is there not enough room for teeth? And the reason can be because of mouth breathing and of course eating soft food and other factors. But mouth breathing is a significant factor. When the mouth is closed, the tongue is resting in the roof of the mouth, and this is helping to create the maxilla into a wide U-shaped arch so that there's sufficient space for housing all teeth. So overcrowding of teeth and crooked teeth point to not just about the aesthetics. We have to ask the question, how has that child's face developed? And if their face has developed adequately and there's enough room for the tongue, it means that their airway is adequate. An orthodontist who goes about straightening teeth. Straight teeth do not make a good looking face, but if the face is developed the way nature has intended that face to develop, it will follow that the teeth will be straight.